If you are a parent and you are at the unfortunate point where maybe your child has already attempted suicide, what's your next step? How do you handle that?
Right. So if this is shortly after a suicide attempt, obviously it's how do we get that person help? Sometimes, I guess fortunately perhaps, a lot of adolescent suicide attempts are not lethal, which is great. But the problem is it doesn't mean they're necessarily better. So we need to make sure that they're getting the help that they need. So, how do we get them connected to a mental health counselor? How do we get them that kind of support? Are they struggling in school? A lot of people don't want to talk to their school about issues that are going on at home or with their child because they're afraid that they're going to get singled out in some way. But if they're really not doing well in school, and it's because they can't get this stuff out of their head, they can't focus at home, this is where you work with sort of the mental health team and say, we need to figure out how to help, because otherwise they get behind in school and then they start feeling worse. So we want to kind of do that. We want to make sure that they're getting the help that they need. The other thing that I think is really important when it comes to a recent suicide attempt, so let's say they ended up in a psychiatric hospital for a couple of days or a week or two or something. People often feel like they get discharged from the hospital, they're definitely better, everything's going to be okay, we don't have to worry about this anymore. That's not always the case. In fact, the highest risk period for a reattempt is usually within the first month after they get out of a hospital. Because what sometimes happens is everybody was engaged around them, they felt people were concerned, a lot of people were paying attention to them. Not that this is an attention-seeking kind of behavior, but people were paying attention to them. They were getting the help they need. They come home, everybody rallies around them, we make sure they're okay. Then they seem like they're behaving normally again. And we go back to the way things were.
For all that support a little.
Yeah, and they feel that. It's like, where did everybody go? And they feel kind of let down, and they feel like everybody's kind of let them go a little bit, and they're withdrawn from other people, and they're not connected anymore. And so it's a real challenge, I think, to kind of say, I'm worried about you, I care about you. We want to make sure that you're getting the help that you need. But to make the assumption that they're fine just because they were in a hospital is really not a very good assumption to make.